Hello, teacher.
Hello now.
How are you, teacher?
I'm good. You're good.
I'm good too, teacher. This time, the question we have is whether the use of antibiotics in dental procedures has any harm to our teeth. If so, what are they in response to that?
First of all, hello everyone. Now, Ardacham, if there's an infection in the mouth, we have to use antibiotics on our patients before performing any surgical procedure. So, what kind of surgical procedures are we talking about? It could be a sinus lift surgery, a surgical extraction, or a wisdom tooth surgery.
Teacher, I was thinking about that too. You mentioned the CRI operation. You had extracted my wisdom tooth first. After that, you had given me a prescription. The use of antibiotics. Actually, this has been a question I've wanted to ask since then.
So why are we using antibiotics? Now, here's the situation. If we extract an infected tooth and don't use antibiotics, there's a risk of septicemia, which is blood poisoning. So, if we extract a tooth that has an infection and we don't manage it with antibiotics, it can enter the bloodstream, leading to symptoms like fever and chills, which can start off mild, but could eventually cause serious infections that might require hospitalization. It varies, depending on the person's tolerance. It's not guaranteed that it will happen to everyone, but what do we need to do to minimize it? While performing the treatment, we need to minimize our risk. That's why we start using antibiotics 48 hours before any surgical procedure. After the treatment is finished, especially after a surgery, antibiotics are continued until the entire course is completed. When choosing antibiotics, what do we take into consideration first? We need to ask our patients if they have any allergic reactions to antibiotics, because antibiotics can sometimes cause allergic reactions and lead to serious complications. Another question is, do any antibiotics cause harm? In the past, tetracycline group antibiotics were used at a young age. Sometimes we still see this in our middle-aged patients, a condition called tetracycline staining, which causes serious discoloration and wear on the teeth. While treating these, we even try to solve these problems with aesthetic treatments, laminates, and sometimes composite fillings. But now that tetracycline groups have been removed from treatment or are not used very often, such situations are not observed with the new generation antibiotics.
It's not happening.
It doesn't happen very often, my dear Ada.
Thank you very much, doctor.
Welcome.
Thank you for the valuable information. Looking forward to seeing you in the next dental talks.
Looking forward to seeing you. Don't forget to follow us, ask questions, and like us. Looking forward to seeing you. Goodbye.